Hello, and welcome to a background on formulary decisions, a legacy of innovation in digital payer engagement. I'm delighted to share with you the history of the platform, how we've evolved over time, and where we're going. If we advance to the next slide, please. My name is Lori Fazio. I am head of manufacturer strategy for Formulary Decisions. I've been part of the Formulary Decisions team now for 23 years. I'm excited to see where we've started, where we are today, and where we're going. If we advance to the next slide. To understand where you are going, you need to know where you came from. So we're going to start from the very beginning. If we go forward one slide. Let's go back to 2009 when the platform first was launched. In 2009, in order for healthcare decision makers to receive dossiers from manufacturers, they had to go to each individual medical information department, request the dossier, and then they would receive a binder of that information. But our team recognized that there must be a better way. And so we partnered with the Academy of Managed Care Pharmacy, and we launched the e-dossier system. And the e-dossier system was intended to be a centralized repository where healthcare decision makers could log into a secure platform, request manufacturers' dossiers across multiple biopharma companies, receive those dossiers in a digitized format, and engage with them within the platform to support their workflow processes. So we started to take that digitization process forward. If we advance to the next slide. We then, at this point now, we had become a standard in terms of where payers would come for dossiers. In December of 2016, the FDA introduced the 21st Century Cures Act, which helped to clarify the appropriate healthcare economic information exchange with payers. At the same time, AMCP launched version 4.0 of the format, introducing the concept of the appropriate dissemination of pre-approval information for healthcare decision makers. In the platform, we started to see payers and manufacturers exchanging pre-approval information and some introduction of HCEI, but it would be several years before that clarification would come where there would be a comfort level associated with that. But certainly there was an interest starting in late 2016 for information to be available to our community within the platform. If we advance to the next slide, we fast forward to 2017. So at this point, the platform is being used for dossiers, but our community is expressing an interest in receiving information beyond the dossier as they evaluate the platform for formulary consideration purposes. So some examples of what they're looking for are other information related to the product beyond solely the dossier, which is a reactive piece. And so we started to introduce other modules into the platform to support our biopharma companies. So the eDossier Plus module was advanced beyond what it currently was, where we were providing activity metrics around the utilization of the dossier. And we advanced that module to include feedback. And that was intended with the purpose of informing our biopharma companies on how the dossier is being used. Were there any limitations to its use? Any suggested updates to various sections to inform them as they look to update their dossier and ensure that they're including the information that is critical for the healthcare decision makers as they're evaluating their product. That's at first and foremost at the core. But beyond that, we introduced the direct payer channel module. The direct payer channel module has two elements to it. It has the resource center and the spotlight. The Resource Center is a dedicated and anchored space directly on the product page where biopharma companies can add additional content that they think is relevant and important for healthcare decision makers to have access to as they are evaluating their product. It's completely self-administered, and they can add content as frequently as they like. The benefit of that, of course, is that then we're highlighting the availability of that information on the homepage for all of our community to see. In addition to that, part of the direct payer channel module is the Spotlight. The Spotlight is intended more for billboards or announcements of content that they think is important for payers to see. Part of the direct payer channel module also allows our healthcare decision maker community to provide feedback on additional information that they would like to see placed in that resource center. And this was in a direct response to our healthcare decision makers indicating that they would like to see content beyond the dossier available to them within the platform. And so as part of that, we also expanded what the platform offered, and we introduced a meta search page where we go to 19 different evidence sources every night to pull in URLs from various publications and make them available to the healthcare decision makers all on this product page. So we started to create more of a stickiness within the platform for our community beyond solely coming in to access the dossier and review it. Finally, we introduced the payer landscape module. So the payer landscape module is a monitoring tool for biopharma companies. It introduces feedback around the product, whether it's perceptions of clinical efficacy, economic value, patient value, and more. It utilizes a standardized survey where we are providing the opportunity for this community, the healthcare decision maker community, to provide feedback on their perceptions of the product, the competitive landscape, other evidence sources that they are utilizing to evaluate this product, as well as to get in the mindset of healthcare decision makers on where they're planning to place this product on formulary, whether they're introducing any restrictions, what would lead to preferred placement, and more. In addition, part of the payer landscape module includes reporting on activity metrics around what's happening in the platform itself. So not engagement on proprietary content, but better understanding of which organizations are visiting your product page, your competitors' product pages, what links are they clicking on in terms of that meta search, as well as how much time they're spending. So just a better understanding of overall interest in the subscribing product and the competitors' products. So all three of these modules really helped to elevate the platform from a biopharma perspective. If we advance to the next slide. So as I mentioned earlier, the 21st Century Cures Act in 2016, but it really was the final guidance from the FDA in 2018 that helped to solidify pharma's engagement within the platform and provide a level of confidence and comfort around utilizing the platform beyond the dossier itself. So one of the things that's part of this guidance is who can receive information related to an evaluation of a product, as well as the types of information that can be received. And so what we saw within the platform is a natural extension to include more pre-approval information in the platform, but we also saw an uptick in terms of incorporating healthcare economic information in the platform. Still, in 2018, we still saw that that uptick was slow, but to date, as of 2022, all of the evidence that's included in the resource center, we're seeing 6% of those do contain some HCEI. What we are seeing, though, is when that content is there, they are accessed on average 4 times per month by healthcare decision makers. So certainly there is interest by the community to receive that information. And for subscribers who put that information into the platform, we are seeing an overall increase in terms of overall product engagement. So 4 times as many unique healthcare decision makers are looking at those products who put that information into the platform, 11 times as more product activity compared to those that are not. So certainly an opportunity to differentiate within this closed, secure platform in terms of the content that you're sharing with healthcare decision makers. If we advance one more slide. So in 2019, AmerisourceBergen acquired Formulary Decisions from Dymaxion, and that really helped to advance the platform because it allowed for a greater reach to the healthcare decision maker audience, so greater awareness amongst US healthcare decision makers about the availability of the platform and the availability to register within the platform. The platform still remains a closed, secure platform. Healthcare decision makers do have to register, provide their license credentials, their role in formulary decision making, and then they are evaluated to determine if they are appropriate to be part of this platform. And assuming that they are, they do have to reactivate every 6 months to maintain that active status. But this acquisition by AmerisourceBergen provided greater visibility to healthcare decision makers on the availability of this centralized platform for them to access, and also for our biopharma companies. We were already being used by top pharma who recognized the value of the platform to extend their reach. But by the acquisition by AmerisourceBergen, it allowed us more opportunity to present the platform to smaller and mid-sized companies who were looking for ways to extend their reach to healthcare decision makers because they perhaps had smaller teams and wouldn't have that bandwidth to reach them. So this was a monumental change and certainly provided the opportunity for this platform to excel beyond where it was at that point. If we advance one. So looking at the evolution of the platform, you'll recall we started as a dossier-only platform, a place where healthcare decision makers could come in, review the dossier, request across multiple manufacturers, and then leave the platform. As we continue to respond to healthcare decision maker needs and evolve the platform to include other information that they really needed to critically evaluate these products, we saw a corresponding increase in activity. And in 2020, it marked a significant milestone for us as our activity doubled year over year. So we were getting more of that stickiness within the platform. And in fact, if we look from 2022 and we go back 5 years, we saw a 5-fold increase in activity. So if we advance one slide. As we look to evolve the platform, we were already including branded products on the platform and biosimilars on the platform, but we recognized that our healthcare decision maker community was also looking to evaluate digital therapeutics. So in 2021, we started to introduce subscriptions for our digital therapeutic companies, recognizing the need for healthcare decision makers to evaluate their evidence within the platform. And as you can see from the first slide, from the top, there's, in terms of the types of digital therapeutics that are being reviewed, there's a combination of all sorts of them. And where they're placing them in terms of benefit falls into various categories. The need existed for digital therapeutics to be within the platform, certainly to include the dossier and other information for our audience. If we advance another slide. In 2022, we recognized that while subscriptions had historically been on a product-by-product basis, many of our subscribers were starting to look at their portfolio of products from a more holistic basis. And so we introduced enterprise subscriptions. So what enterprise allows a subscriber to do is to look at their portfolio of products from pre-approval all the way through launch and beyond, and evaluate where those products are in the life cycle and come up with a mix of subscriptions that make the most sense for that portfolio, recognizing that that will shift over time. So the introduction of enterprise provided that unparalleled flexibility in terms of subscription mix, as well as additional features and functionality beyond what is typically included with a product subscription. So whether it was unlimited access for team members, or perhaps unlimited e-dossier conversions and updates, as well as more of that white glove support to introduce a dedicated subscription engagement lead who would support that subscription across the portfolio, additional insights reporting beyond what's included with access to the insights dashboards, as well as consulting support, creative support for content that you might want on the platform, and other additional value adds to the platform, including access to our biosimilars resource hub, additional templates and materials for the field team. So this really provides a more comprehensive approach to the subscription over time. If we advance one. At the end of 2022, the PI Act had been introduced into Congress, passed by Congress, and then signed by the President in December of 2022. This is a huge step in terms of where we're going as a platform and as a country in terms of sharing information with healthcare decision makers. I think it will certainly help to solidify the importance of sharing pre-approval information with healthcare decision makers. We know in the platform that they are starting to evaluate products earlier so that they are prepared for the introduction of those products, the approval of those products. We know that sweet spot tends to be in that 6 to 12 months pre-approval, where we're seeing payers start to request product dossiers, to look at information. And so from a biopharma perspective, it's an incredible opportunity from a market shaping as you're introducing your product. But certainly the PI Act will advance the opportunity and the comfort for biopharma companies to share information with healthcare decision makers. Advancing one. So where are we today? If we look at the number of subscribers that we have currently on the platform as of 2022, we have more than 60 active companies that are engaged with Formulary Decisions. All of the top 10 are utilizing us across their portfolio. I think it's also important to note, though, that small and mid-sized biopharma companies are utilizing Formulary Decisions for extended reach because they don't have the size of the field teams. They want to understand what perceptions are of the product. They want to better understand the competitive landscape. So we have a whole range of different subscriptions that will appeal to pharma of any size. When we look at how many subscriptions we've had just in the past 10 years, we've had more than 400 subscriptions, more than 700 dossiers have been housed on this platform. And when we look at the healthcare decision maker audience, our coverage represents more than 269 million health plan covered lives, which is more than 95% commercial covered lives, more than 90% Medicare, more than 50% Medicaid. And when we look at these organizations, we have representation from more than 900 organizations, from your traditional payers, whether it's PBMs or managed care organizations, but also hospitals, IDNs, health systems, academia as they're affiliated with a hospital or health system, as well as the public health systems, including the VA, DOD, and various state programs. From a healthcare decision maker perspective, we have created dedicated product pages for more than 3,000 products that are available on the platform. When they land inside the platform, we are highlighting our Biopharma subscriber content on the homepage. And then from there, they can navigate either to therapeutic area pages, disease state pages, or dedicated product pages. When we look at our healthcare decision makers community, recognizing that they do have to reactivate every 6 months, more than 50% of our user base are longstanding users, meaning that they have been active on the platform for more than 2 years now. Advancing one slide. So we welcome the opportunity to partner with you, to look at your product and evaluate the subscription mix that will make the most sense, starting right from pre-approval through launch of the product. The platform really is a fit-for-purpose digital channel. It helps to support your digital engagement strategy, to augment what you're doing in live interactions, to provide that extra tentacle to ensure that you are reaching healthcare decision makers with the critical information that they need to evaluate your product. So we welcome the opportunity to review your product and look at the subscription mix that would make the most sense for you. Advancing one more. In closing, let's partner to build a subscription that will meet the needs of your engagement with our community, and to provide the critical feedback and activity metrics that will help to support and refine your market access strategies.